Some years ago, a cigarette manufacturing company used to advertise. The advertisement told and showed active men, saying that for men of action, satisfaction, smoke or ban cigarettes. Today, we have to rephrase it by saying for men of action, dissatisfaction. Why? Smoking is definitely injurious to health. Apart from the government concerted efforts of telling people that smoking is bad for your health, people continue to smoke. Of late, the number of women smokers in the younger generation is increasing. A medical study has clearly found that men who smoke regularly run the risk of developing erectile dysfunction 26 times more. Well, a burning cigarette releases 400 toxins, which is damaging the body. Among them, the most important ones are tar, nicotine, and carbon monoxide. Among this, nicotine is the most addictive one, and that is why people get hooked on to that. To overcome the stress as a habit, they continue to smoke and are unable to overcome that habit. Nicotine, which is addictive, damages the inner lining of the blood vessel. The blood vessels contain three layers: an outer layer, a middle layer, and an inner layer. The inner layer is called endothelium. This is where a lot of enzymatic reactions take place, and it manages and controls the blood vessel contraction and relaxation. Nicotine damages this inner layer called endothelium, producing what is known as endothelial dysfunction. Because of this, the blood vessels get hardened and they are unable to relax. With the net result, the lumen of the blood vessel is reduced and sufficient blood will not be flowing in these blood vessels, and thereby the organs get insufficient blood supply. The main organ which suffers from this is, apart from heart and other things, is the penis. There will be insufficient flow of blood into the cavernosal or the pineal arteries. Because of this, the man can develop an erectile dysfunction. This is the pathology behind that. Not only that, because of this hardening of the blood vessel, men and women will develop high blood pressure. This is important for us to understand. And number two, it is not only the men who suffer, even women smokers suffer. By narrowing of the blood vessels in the vagina, sufficient lubrication will not be produced, making sexual intercourse painful for the men as well as to the man, for the woman as well as to the man. And number two, insufficient blood flow to the clitoris will reduce the amount of clitoral enlargement, thereby reducing the amount of friction the woman can derive during intercourse, robbing her of her orgasmic pleasure. It is not only sex which is affected, even the fertility status, the ability to produce a child, is also affected. In men, the sperm count reduces, its movement is adversely affected, the structure of the sperms are damaged. In the woman, her ovary is affected, thereby ovarian hormone production is reduced, the eggs are not properly released, and even if they are released, they don't mature properly, and birth defect will be there in the DNA, and the fallopian tubes get hardened, damaged, and because of that, the egg which is produced in the ovary cannot be transported back into the uterus. So all these things are going to be affecting the sexual and reproductive health of both the men and the woman. So we have to understand that. So, friends, you have a choice whether you choose a cigarette or you choose your sex life or fertility life, reproductive life. And the point is very simple. People may say, Doctor, I'm unable to overcome this habit. What to do? So, you choose first of all to abstain from smoking. If you think that's not possible, seek the help of a medical professional who is a specialist in de-addiction program. He may put you on to nicotine replacement therapy. Please remember the damage is maximum not only in men but even in the woman, affecting their both sexual and reproductive lifespans.